This is Patty Walker, your local dietitian and certified diabetes educator and the host of Nutritional Wisdoms. I am super excited to have my guest, Dr. Tina Costello from Women's Integrative Health.
Thank you for having me, Patty.
Oh, you're welcome. Can you tell the audience a little bit about yourself?
Sure. So I recently opened Integrated Women's Health in Wolfeboro. It's a medical office, and it blends regular conventional medicine with a holistic type of medicine, essentially trying to help people get to the root of what their illnesses are and what may be causing them, sort of a lifestyle medicine. And I know that that's near and dear to your heart because a big part of that is nutrition. And, you know, food is medicine, and so when I talk to patients, I like to hear about what their diet is.
Oh, absolutely.
And I think you have some interest in integrative nutrition, do you not?
I absolutely do. I'm in the midst of an 18-month program on getting certified for integrative nutrition, and I'm able to offer food sensitivity testing and nutrient deficiency testing right now, and I look forward to expanding those offerings so that we can really get to the root cause of why people don't feel well and heal it naturally.
That's great.
Yeah.
I'm excited to hear that.
So, talking about natural treatments, today's topic is all about sleep. I have to tell you, Tina, the majority of my clients will come in, and sleep is so important for persons with diabetes and prediabetes that it's a question I ask: how is your sleep? More than half have difficulty with sleep. Either they don't sleep well, don't get enough sleep, or wake up. So today's topic is optimizing our Z's.
Mm-hmm.
So if you'd be able to tell us why sleep is so important and what happens to the body when we're sleeping.
When we're sleeping.
Yeah.
It's a great question because sleep has really mystified scientists for many, many years, but there are some facts that are now well known, and there are different stages of sleep. And depending on what reference you look at, there are 4 or 5 stages. Sometimes they combine a couple of them. But essentially, the first stage of sleep is a transition period when you're really still awake but kind of fading in and out of consciousness. Then we gradually go through the stages where you go into a bit of a deeper sleep. And during that time, we know for sure that a lot of restoration takes place. It's really essential for us to sleep, to regenerate tissues, the cells, right down to the cellular level. We need that time to restore.
Now, I've heard cholesterol is produced while we're sleeping. Is that true?
It is. That's an important part of it. The hormones are important, particularly growth hormone. That's one of the critical factors. When you're sleeping, the growth hormone helps to repair a lot. It has to do with a lot of cellular repair, so that's critical. And then when you go into REM sleep, that is very critical for the brain. We like to think that the slow wave sleep, which is the majority of the sleep, probably 75 to 80% of the time we're in slow wave sleep. But then when we move into REM sleep, the brain actually is very activated, and it's believed that a lot of our long-term memory is set down during that time, and certainly REM sleep is critical in having us wake up feeling alert and oriented, and it's important for mental clarity throughout the course of the whole day. So we need REM sleep. We need all sleep, but REM in particular.
Very good.
And the cycles are interesting because it's not just one time that you go through the cycle. Most people, they last about 90 minutes.
Okay.
And
so each cycle is 90
minutes,
Gotcha.
right, through the 5 stages. And then we like to repeat it, ideally 5 times during the night. And not everybody does, but if you have enough time during the night, you'd go through that cycle, that 90-minute cycle 5 times.
So that's the 7 to 8 hour sleep recommendation.
Exactly.
Gotcha.
And there's variation. Some people don't take 90 minutes to go through the whole cycle, and some people don't have 5 cycles, but ideally that's the case. Yeah.
So circadian rhythm, does that affect sleep, or how is that interacting with sleep?
So the circadian rhythm is the thing that is the sleep is part of, and the circadian rhythm is more of like a 24-hour sleep wake cycle. It's very influenced by light and dark. So in days before artificial lighting, it was influenced by the sun, you know, and that's why now sometimes circadian rhythm abnormalities happen is because we're under artificial light all the time.
Oh, I will have a solution for that
You
later
do,
on.
I know you do. So it really, you need to have light during the day and then pay attention to as the darkness comes at night. And that's other 16 hours of the day that we're not sleeping, other processes are happening that are part of the circadian rhythm as well. You know, as you mentioned, cortisol and cholesterol and other things.
So I often tell my clients that have difficulty sleeping, try to expose themselves to ideally daylight, but a bright light within a half hour of waking. Will that make a difference?
It does. That's a great thing to say to people because that exposure in the morning sets the stage for the circadian rhythm. It reinforces the 24-hour cycle, and you might think, well, it's in the morning, how does it have to do with sleep? But it actually really does, because then if you have that light first thing in the morning, it reinforces that 24 hours so that when they go to bed at night, the melatonin is produced and they go to sleep restfully. The melatonin is the thing that it regulates that sleep cycle that has to do with the light during the day and darkness at night.
Gotcha. You know, I will say in my practice, I do see a lot of persons with diabetes, and a lot of them have a condition called sleep apnea, where they will stop breathing for brief periods of time while they're sleeping, kind of gasping for air, and then get back to sleep. But it really disrupts their sleep cycle. Mm-hmm. And what was really fascinating to me is that most of them didn't know they had it. It would be their significant other that would tell them, oh, of course, honey, you snore and then you stop breathing. Or they're tired, so they mention it to their doctor, and their doctor suggests a sleep study, and it's diagnosed that way. Are there signs and symptoms that, people could be looking out for if they may have a sleep disturbance that they don't realize?
Mm-hmm. One thing that can tell you that you may be at risk of sleep apnea is if your bed partner tells you that you snore. That's actually a really good indication that you should have it tested and see if you do indeed have it.
Good idea.
But, objectively, you or I could look at someone and just say, from an anatomical perspective, you could say, ooh, their neck looks like
Mm-hmm.
they may be at risk. If they have a wide, kind of short neck, that puts them at risk of having sleep apnea.
Yeah, I had gone to a seminar a few years back, and they had suggested women with a neck circumference greater than 16 and men with a neck circumference greater than 17 inches would be an increased risk for sleep apnea. Not that if your neck size is 22, you have sleep apnea, because obviously professional football players would have a neck circumference larger than that, and just because you have a large neck doesn't mean you have sleep apnea, but it's something to be aware of.
Right, exactly. That's a good thing to go by. Yeah.
All right. So this is such great information. I really, really appreciate you're here. So I know you brought a checklist that people can just go through to see if they might be at risk.
I did. It's a sleep hygiene checklist, and it might just be interesting for our viewers to see how they would answer these questions, true or false. And if you'll bear with me, I'll just go over them slowly so you can take some time to answer them. Yeah. So first thing you might want to ask yourself is this true or false? I rise and go to bed at the same time every day, even on weekends.
Consistency is important. So we can't catch up on sleep on weekends?
No. And that people I know want to do that. Weekends are the time when you want to stay up late and sleep in or catch up on sleep, as you said, but it really messes up your whole circadian rhythm. It's much better to stay in a routine, even on the weekends.
Gotcha. If
you have trouble sleeping. That's a remedy. Again, I do not take naps during the day that last more than 20 minutes. So it's actually quite advantageous to take a power nap. 15, 20 minutes is great. It increases people's productivity if you can do that during the day. If you happen to have employment that you could do that.
I had read an article that in Japan they actually have businesses where you can go into a dark, comfortable area and take your 15 to 20 minute power nap.
See, they know they're ahead of their time, because that does help with productivity. But don't sleep more than 20 minutes, because that just interferes with the whole circadian rhythm. Important one, I avoid caffeine, nicotine, and alcohol for at least 6 hours before bedtime.
Oh, we're going to reduce that.
Right? I know, exactly. 6 hours is really quite,
Yeah, that makes a new New definition of the afternoon cocktails.
Exactly. Really early afternoon. One thing that's interesting, I thought, and I must say I hadn't really considered this, but if you have trouble sleeping, it's important to say, I do not exercise for 4 hours before I go to bed. So that's vigorous exercise.
That would be high intensity exercise. Sometimes just a gentle walk before or after your meal can help promote sleep, or yoga.
Right.
But the vigorous high intensity exercises, I absolutely agree with that.
Right. You're not going to go for a run and then come home and shower and go to bed. I limit my liquids in the evening so I can reduce my need to use the bathroom at night.
Yeah, pretty
That's
self-explanatory.
obvious, yes, right. I practice bedtime rituals such as planning for tomorrow, dimming the lights, reducing technology use, practicing an activity like mindfulness. That's a good, you want to check true to that one. My bedroom is kept dark and comfortable at a comfortable temperature.
Yeah, and I hear different things. I've been told like 60, 65 degrees. I know that's where I prefer to sleep. Is that?
Even anything 68 and below, I would say.
Okay.
It needs to be cooler than it would normally be during the day.
Gotcha.
Your temperature in the house.
Perfect.
For sure. And my bedroom is for sleep. I do not watch TV or work on projects while I'm in bed. That's tough. A lot of people go to sleep watching the television, and that it really can interfere with your
Get the
good
TV
sleep.
out of your bedroom.
Exactly, for many reasons. Yes. I go to bed only when I feel sleepy. That's important. You can't go to bed while you're wide awake thinking of a million things and hope that you're going to fall asleep.
But that gets back to circadian rhythm and consistency, so we kind of have the same bedtime.
Right.
And setting a routine, if you don't, would that help?
Exactly.
Okay.
Right. Just get yourself into that routine. It really is helpful. And if you can't fall asleep within 30 minutes, get out of bed and do something relaxing. So don't lay in bed and agonize over not being able to get to sleep. That's, as we talk about, that's just a perpetuating factor. So try to keep that in the back of your mind. 30 minutes.
Nice.
So there. So that's a little checklist.
Thank you. What great information. Appreciate that. Why do we struggle with sleep in our society?
I know. We've talked about some. I like to think of it as the 3 Ps. There's predisposing factors, precipitating factors, and perpetuating factors. So for predisposing factors, we've talked about sleep apnea. That certainly interferes with your sleep. Another common thing that people may not consider but makes sense is anything that causes chronic pain.
Sure.
So you may have trouble getting to sleep if you suffer from back pain, neck pain, or you may be able to get to sleep, but then you may wake up in the night because you've been sleeping in the same position, and that becomes painful. Another thing is just simple restless leg syndrome.
Yeah.
It's not really simple. It's very problematic for some people, but that certainly can interfere with your sleep. Or reflux, which I know we'll talk a little bit about causes. Reflux, when you go horizontal, of course, can interfere with your sleep.
Yeah,
So that's a
and-
problem.
And I do have clients that don't even know they have reflux, like sleep apnea, and I'll ask them, do you wake up with a hoarse voice in the morning? Because they were unaware that they even had reflux, but they have intolerances to many foods that could cause reflux.
Right, exactly, true. And another thing that some of your clients may experience is hypoglycemia.
Oh, low blood sugars, absolutely. Yeah.
In the night, so that can certainly be a predisposing factor. And a common thing is many substances that people use before bedtime.
Oh, alcohol, caffeine?
Right, exactly. So we know that those things too close to bedtime can interfere with a good sleep.
But doesn't alcohol make you sleepy?
So that is a common belief, and
It
it
does.
does. It does. It does. And people will say, "Well, I know if I have a couple of drinks, I can fall asleep." And some people will actually take something to bed with them. But truthfully, what happens is the alcohol causes your adenosine to increase in your body, and adenosine puts you to sleep pretty quickly. Like
Okay.
Anybody who's had
We
a couple
like
drinks will
adenosine,
say,
yeah.
knocks you right out. However, what will happen is that then the adenosine in your system will drop, and you'll wake up before you've had a true sleep, a truly restful sleep. So it may help you go to sleep, but a lot of times if you think about it, if somebody puts it to the test, they'll admit that after a few drinks, they may fall asleep, but then about 1 or 2 o'clock in the morning, they wake up.
you know, and with persons with diabetes, it could be a rebound hyperglycemic or low blood sugar reaction from the alcohol too, so that could be the same thing.
Right.
Good
Exactly.
point.
It's not a great. And you know, the other thing that alcohol does is it blocks REM sleep, and we talked about REM sleep, how that's reparative for the brain.
Yes.
And if you don't get REM sleep, you wake up and you feel groggy and unfocused, and that's that whole kind of hungover feeling that you can get in the morning after alcohol. So.
All right. Yeah, and caffeine can be tricky because not everyone has the same sensitivity to caffeine. So I know for myself, I probably could have a cup of caffeinated coffee at 7, 8 o'clock in the evening and still go to sleep and have a restful night's sleep on my same routine. But other people are very, very sensitive to caffeine. So caffeine is in many sources. So the obvious ones obviously is your coffee, your caffeinated teas, not your herbal, but your caffeinated teas. Green tea could be caffeinated or decaf. Energy drinks, that's a big one. And then chocolate, cocoa, and anything else that might have caffeine that you're...
I think those are the big ones.
Those are the big ones. Yeah.
And that's true. People don't realize, because some people who are really sensitive are sensitive to just a small amount of tea or chocolate.
Yeah.
Other people aren't.
Yeah.
So.
So for those people, I actually recommend they stop all caffeine by 2 o'clock in the afternoon. Oh, colas. Colas is another one.
Oh,
Not the clear sodas, but your Pepsis and your Diet Cokes. I mean, they do have, or colas. They do have both caffeinated and decaffeinated versions, but all those can affect the caffeine intake. So if you know you're sensitive, first try not to have any caffeine after 2 o'clock in the afternoon. And another way of doing that is to start in the morning and have your caffeinated beverage of choice. If you're going to have a second one, maybe combine it decaf and caffeinated. And then the third one, switch over to a decaffeinated version, so you slowly wean yourself, but you can still have that first enjoyable cup of your caffeinated beverage.
Right. See, that's nice. Allow people to still do that.
Yeah. Any other substances that they should be aware of?
Well, and you know what? Some people don't realize that nicotine is actually quite a stimulant, and anyone who's ever used a nicotine patch before will tell you that it affects your sleep. So, you know, having a cigarette before you go to bed, that will probably affect your sleep.
Makes sense.
Yeah.
All right.
So one thing that I feel like I want to talk about as far as precipitating factor in this day and age is stress.
Oh, that's the elephant in every room. I mean,
Right,
that
right.
is huge.
So our life nowadays is so stressful, and stress in itself is a whole topic. You could do a show on stress.
You could do 2 shows on stress.
You could. So stress. Suffice it to say that it makes sense that if you have something in your life that's stressful and you go to bed and your mind is racing, you are probably going to have difficulty sleeping. And instead of taking a sedative or something that knocks you out or drinking alcohol, you're better off to try to find a healthy way to deal with the stress. I know people know that, but sometimes common sense doesn't always come into play.
So quick things that they might do to alleviate the stress?
Right. So in the moment, I mean, the bigger picture is to get to the root of what's causing the
Right,
stress. But
right.
in the moment, maybe just, focus on your breathing in, count, in and out, and just slowing your breathing down. And I know you have a nice...
I do, but I just realized counting sheep is actually a meditation.
It is.
I never thought of that, because you're just kind of focusing, you're just in the present, focusing on that one thing. Yeah, a good friend of mine had a good idea of a way to get a blissful night's sleep, or to at least calm down the mind. It was put your hand on your heart, put the other hand on your head, and close your eyes, and then just focus on your breath. Breathe in slowly and exhale slowly. And what that eventually does is it calms the mind down and centers it to the heart's energy, so it just slows everything down. And you might be surprised, you might wake up in that position too. So
I love
that means you
that.
got a really good night's sleep if you wake up in that position.
In the same position.
Yes.
Oh, that's so nice. Exactly. So those are the, if you can't deal with whatever the stress is that's going on in your life in a bigger way,
Yeah.
certainly you can try to get the stress in your body to release at bedtime.
Yeah, great,
Exactly.
great.
Right.
So perpetuating factors that affect sleep, what would those be?
Well, ironically, the biggest perpetuator is worrying about sleep. So sleep anxiety.
Gotcha.
So if you've had an episode of poor sleep, or if you've gone through a stressful time where you weren't able to sleep, then it becomes your story, and you say, oh, I can't get to sleep. I never can sleep. I have such insomnia. And the more you worry about it, the more it happens.
Well,
So-
hopefully some techniques we'll go over at the end of the show will help with that, so they can get a better bedtime routine.
Exactly. And if it all else fails and you're lying in bed thinking that, then like we mentioned before, get up out of bed and don't lay there and agonize over it. Get out of bed and go somewhere comfortable and quiet. Perhaps you can stay in the room, but if you have a partner, you may need to go out into the living room and just sit quietly. Maybe flip through a magazine. Don't turn on the television. Don't turn on your computer.
Listen to
And-
music.
Or listen to music. That's perfect.
Relaxing
Just
music.
Exactly. And then just until you feel sleepy again. And then go back to bed.
You know, another perpetuating factor I find with my clients is when they eat their food. The majority of people will eat over half their calories from supper till bedtime.
Yeah.
They have a breakfast, they have a lunch, but when they get home, they're hungry, so they have their largest meal, and then they relax and they're watching TV, which obviously isn't ideal for sleep issues, but they'll have snacks. They'll have the ice cream, they'll have the potato chips, they'll have the cookies, and digestion could interfere with a good night's sleep, and as you'd mentioned, reflux and heartburn could happen, but ideally the body will have a better night's sleep if you wait or stop eating 2 to 3 hours before bedtime, and have a lighter meal at supper and maybe a heavier meal during the afternoon if possible, but try to lighten up the amount that you eat in the evening, because that could make a big difference in the quality of sleep, and
really
not
does.
having snacks could be a good thing.
Could help. I know. And I have to say I'm guilty of that. I often will have snacks in the evening. And do you have any advice for people like me? Are there some snacks that would be better than potato chips and ice cream?
Yes, that's true. So actually, we didn't talk about the processed food and the processed sugar, but that can cause sugar rushes, and we did talk about the low blood sugars afterwards. So you want to avoid those types of things. But there are some foods that can promote healthy sleep, and I think all of us have heard the tried and true warm glass of milk. And that's because it has tryptophan, and tryptophan is an amino acid that actually helps us sleep better. So a small glass of warm milk, and it can be any milk, but I do like a milk with a little bit of fat in it for bedtime. So it could be the skim milk, but a 1 or 2% is also fine. Whole milk, maybe a half a glass instead of a full glass. And turkey. A lot of us have sliced turkey. We hear about Thanksgiving that we're so tired after our meals. Turkey has tryptophan. And so a couple slices of turkey could also help with sleep. And then we'll get to magnesium, which is a very, very important mineral to help with sleep and relaxation and anti-anxiety. But a couple foods that have magnesium would be almonds, pumpkin seeds, or even half a baked potato.
That's great.
And I'm going to recommend the baked potato be eaten cold, because then you get the benefit of something called resistant starch, which feeds your gut microbiome, and our body rejuvenates as we sleep, so it fuels the healthy microbiome. So it's a double benefit. And potato has some potassium in it, so it can help with restless leg syndrome also, in addition to magnesium.
That's great.
But small portions, small portions, and a nice restful cup of tea. And I know that you have a wonderful tea recipe that you're going to be sharing with us, so that's something else that could make a difference if you're not apt to have to get up to use the bathroom because of the tea.
Right. Just small amount of tea.
Yes.
Right. Great. That's perfect. I love that.
Yeah. All right, so before we close out, I just want to ask, are there any healthy bedtime routines that we can kind of quickly go through to, people that it may not be what they're eating, what they're drinking, how much, caffeine or alcohol they have. It may be a simple routine that they could change to help get a better night's sleep.
Right, I think so. And I borrowed a handout from one of my teachers at the University of Arizona. His name is Dr. Ruben Nyman, and he has these strategies for a serene sleep, which I think are really nice. And maybe we can just touch on a couple of items in that.
Sure.
So I think we mentioned ritualizing the rhythms of activity and rest. So we're trying to stay with that natural circadian rhythm that you talked about, getting exposed to light in the morning and then dimming our lights in the evening as the natural daylight would pass by.
So, but what I see with the majority of us is that we watch TV, we're on the computer, we read from the iPad, so we're exposed to that blue light that tricks the mind into thinking it's daylight?
Exactly. And so even though I would love for people to not do that, I have to live in reality and know that people do. So there is a bit of a trick that you can do to reduce the blue lights, and I think you have those super cool glasses, Patty.
So,
yay.
These are blue light blocking glasses. You can put them over if you have prescription glasses or reading glasses. They go right over, but they totally eliminate any blue light from the bottom, the sides, the top, straight on. So if you're not able to avoid TV or the computer, or you want to read books but it's on your iPad, to do that and use these. And also getting those blue lights out of your bedroom, which includes the LED alarm clocks and the cell phones. I mean, at least turn it upside down.
Right, if you have to keep it by your bedside, which I know lots of people will say they use it for an alarm, which is fine, but
but
put it
reducing the
upside
light
down.
and getting the TV out of the bedroom.
Yes,
Yeah.
exactly. And what that is doing, and we mentioned briefly about melatonin, is that, when the photoreceptors in the brain are not receiving that light, then the body says, okay, it's time for sleep. So that's melatonin being produced from the pineal gland. And so sometimes melatonin can help with sleep. And if you feel like maybe you'd like to augment your melatonin with some supplement, you can start with a very low dose. You can take a 0.5 milligram or 1 milligram of melatonin. It's not a sedative. It does not cause habitual use or dependence, and it's very safe. So that can.
But start low and go slow.
Exactly. Don't go out and buy the 10 milligram tablet. It will knock you out and you'll be sleepy in the morning.
Okay.
So, and then we mentioned quieting your body's noise. So don't use counterfeit energies. Don't use caffeine and alcohol, sugary foods, anything like that. And if you are going to have drinks, of course, have a drink earlier and have it with food if possible. That's a little better.
That would make sense.
Yeah. And one of the things I like is he suggests having a sleep sanctuary so that your bedroom, you don't dread going to bed and worry that you're not going to sleep. Instead, you think, oh, isn't this lovely? It's a nice, comfortable place. It's cool and dark. As you mentioned, turn the alarm clock away so you can't see that. And the temperature somewhere 60 to 68 degrees, somewhere along those lines.
Yeah. And what about mattresses and pillows?
Yes, that's a really important point, that if you're sleeping on a rock hard mattress or it's an old mattress and the springs are sticking into your back, obviously that's not going to give a restful sleep.
Yeah,
So
my husband and I just switched our mattress, and I have to tell you, last year I had such bad neck pain, and now it is totally resolved with the new mattress. And we had an excellent quality mattress, and it was 12 years old, and I said, but I love this mattress. And I had to give it up, and it made such a difference. Such a difference.
I know
And
we
there's-
think mattresses last forever, but they
They
don't.
don't. They
Yeah.
don't. And pillows the same way, or a mattress top. a topper. If you can't afford a new mattress, try a new mattress topper. That could make a difference too.
Right, exactly.
What
That's
about
true.
noise? Would up here where we are, there's not a lot of noise pollution, so to speak. But is there anything someone can do with noise if it's too noisy?
Yeah, well, some people enjoy the white noise. You know,
Yeah.
you can get a white noise maker, or I know I have friends who will just run a fan, and if you don't want the fan blowing at you, you know, you can.
Right, but that cools the temperature of the room down also. That's good.
Some white noise. That's true. We're spoiled in the country. We don't have the sirens and things going as often. And then, just a couple other things I would say that just to reinforce, to go to bed when you're sleepy. Don't go to bed, and hopefully you'll get yourself into a rhythm where you will be sleepy when it's appropriate time. And just also embracing the whole routine, and when you do wake up in the morning, say, this is a great day, enter the day with intention and mindfulness, and end the day the same way. Maybe have some time to feel grateful for things that have happened during the day, and just allow yourself to ease off into sleep.
Those are simple stress reductions, so that's great.
Yeah.
Yeah. So last question before we end. Supplements. Are there any tried and true supplements that you recommend? I know I often hear about magnesium as a great supplement before bedtime.
I think so. I think magnesium, I mentioned briefly melatonin, but also magnesium is a very natural, relaxing way to help with sleep. I personally recommend that people, if they want to take something to help them sleep, is to try a chelated magnesium, like a 400 milligram tablet. But that's mostly
About an
because
hour before bed?
right.
Okay.
And I take the chelated because that's what I was taught to take. But maybe you can talk about the different types of magnesium.
Yeah, magnesium is super important. I mean, it literally is involved in over 300 bodily functions, including, the motility of the gut versus getting a restful night's sleep, reducing anxiety, helping reducing muscle twitching, helping with restless leg syndrome. So, and the majority of us are deficient, and that's because alcohol, stress, diet high in white flour, white sugar, processed oil, all increase our needs for magnesium, but also our soil doesn't have the same amount of magnesium that it used to have. So magnesium in small amounts is a very safe supplement. I agree with you as far as getting a good quality magnesium, which is the chelated amino acid varieties. So those would be things like glycinate, taurate, malate, or citrate. I'm going to give a special talk about the citrate, because if you tend to be constipated, that would be the one I would start with, because that one especially has a powerful impact on bowel motility. And so, but if you don't want that side effect, then stick with the others, which could be the glycinate or I'm not sure if it's glycinate or glycinate. I think it's glycinate.
I think it's glycinate.
Glycinate,
Right.
taurate, and malate. And you might think that those are more expensive, and they are, but they're also better absorbed, so you need less of it. For instance, if you get the oxide, which is the least expensive, it's the least absorbable form, so you may not notice any benefit with
You're
the
not gonna get
oxide.
the benefit,
And
right.
so having a good quality supplement could make all the difference. And some people need a little bit more than 400 milligrams, and I do suggest if you ever go over 500 to split the dose, and maybe have some in the morning just to that it would mean that you're deficient, and so just to replete the stores, and then use the extra dose at bedtime to help with the relaxation benefits of it. Yeah, and
I
for
agree.
those that don't want to take any supplements, you can also get magnesium through an Epsom salt bath. So
That's a great idea.
that would go with a bedtime routine if your mind is wandering and you want to do something relaxing. It would be a cup of Epsom salts. You could add a small amount of baking soda, maybe a quarter, half a cup, and fill the bathtub with hot water to as hot as you can tolerate. And you might want to try some lemon, essential lemon oil. I mean, not lemon, lavender.
Lavender would be
Lavender
great. I
would
was
be
just
great.
thinking
Yeah,
that
I
would
was
be-
thinking lemon. But lavender would be much, much more relaxing. And just relax. Just close your eyes and relax for 20 minutes. And you will absorb the magnesium through your skin. And so that's another way of getting magnesium without supplements.
That's
And then,
great.
you know, obviously the pumpkin seeds and the almonds and even a banana. You know, a banana would be a good bedtime snack, small one.
Exactly. I love it.
Yeah.
Yeah.
So, any herbs? I know we're wrapping up, and you have a tea.
I do. I have a
So-
tea.
So, before we wrap up, Tina, I know you have some herbs that you'd like to share with us and a special tea recipe.
I do. So if you ask herbalists about sleep and different herbs that will help with relaxation in general and sleep, there are so many different ones. So I just brought a few of my favorites. I actually went to the Wolfeboro Co-op, and this is a mixture of, it has lavender and lemon balm, and have a smell. It's so nice.
Oh, it smells
Chamomile,
wonderful.
and a little bit of passion flower. So what I did was I just mixed equal amounts. So if you have a small bag, you know, an ounce of each, you can just mix them all together and keep them like this. And then when you're going to make your tea, you can take a tablespoon of the loose tea.
So the combination of all
Of
the four,
all of
just a
them.
tablespoon goes in there. Yep.
And if you have like a little tea ball that you can put your loose tea in and let it steep. The interesting thing is you need to let it steep for 10 or 15 minutes. You can't,
Okay.
it's not quite like a bag, although there are some tea bags that you can buy, Sleepy Time tea,
Sure.
which probably has similar things in them. A lot of them have chamomile. But if you do that and you steep it for 10 or 15 minutes, keep it warm, cover it. I have a little tea cozy at home that I put over it, and then you can have a nice little cup of tea. Not too much, right?
Not too much.
Mm-hmm.
Oh,
Not bad.
that's wonderful.
Yeah.
Well, that's our show today. This is Patty Walker and Dr. Tina Costello wishing you a restful night's sleep.